my name is Kelsey Benak, and I'm doing a how-to demonstration on passive and active range of motion. So how many people have had friends or relatives that either live in a nursing home or have had an injury? In this presentation, I want to explain the importance of rehabilitation and the proper active and passive range of motion exercises. I have trained and have been a certified nurse aide for 2 years and have learned this exercise technique and have passed the state testing. The exercises are performed actively and on command with the client involvement. Passive range of motion is when the healthcare worker provides the movements for the patient. Active and passive exercises are important tools of rehabilitation. The ability to help a patient recover from a stroke, fracture, or joint replacement is in the hands of a properly trained rehab assistant, nurse aide, and the therapy leader being the physical therapist who leads the team in developing a plan for recovery. The exercise program is extremely important. Family and friends play a key role in the success through the willing participation in the therapy and education on proper range of motion, as well as other exercises of movement. The importance of the exercise technique with positive feedback from therapy staff and family are key elements to success. So, what is range of motion? Each joint in our body has its own level of flexibility. The flexibility is the range of motion around a joint. Some individuals require range of motion exercises to be done to keep their joints flexible and to reduce pain. So I'm going to demonstrate on a member of the audience an example of active range of motion and passive range of motion. Okay, so active range of motion is when the patient can actively move their body part on command. So an example I'm going to do is rotation of the wrist. So I'm going to have Courtney rotate her wrist. That's one way of active range of motion. Another one I'm going to do is have her do abduction and adduction of the arm. So that's adduction and that's abduction. So again, active range of motion is when they can do it on command. Passive range of motion is when the healthcare provider puts the patient's body part through the ranges of motion because the patient is unable to. So an example I'm going to do is I'm going to flex and extend her arm. So this is flexion, this is extension. So that's one way of passive range of motion. Another one I'm going to do is supinate and pronate of her hand. That's supine and that's prone. So those are some active and passive ways of range of motion. So once again, range of motion, both passive and active, are exercises that are necessary in rehabilitation of patients with injuries, surgeries, or even strokes. Today, I demonstrated examples of passive range of motion, which was flexion and extension, and supinate and pronate of her hand, and active range of motion, which was adduction and abduction of her arm, rotation of the wrist. So thank you guys for watching my speech on range of motion.